Now it's known as Czech. So he was an Austrian neurologist and also founder of psychoanalysis. Like I told you, he is considered very influential in the field of psychology because of his contribution. Because many of the psychologists who came after Freud, even they criticized his psychoanalysis, still. But there was something on which they admired the works of Freud. The next slide, sir. So he is, Sigmund Freud was, as I said the before slide, he was born on May 6th in Freiburg, Moravia. Like I told you, it is right now in Czech. And the next slide. So he studied medicine in the University of Vienna, and later he studied about hysteria. Most of his work was towards reading about the mind, the functions of mind, and mostly with the neuropsychology and neurology. So he completed his medical degree and started to work at Vienna General Hospital. And when he was working with the patients who were having hysterical problems, and he was his intensive work on hysteria made him to realize, okay, why these people are behaving in this particular manner? Is there any connection between the different states of mind? So Freud, he traveled to Paris to study under French neurologist Jean-Martin Charcot, with whom he was associated very closely, and he got influenced with the work of Jean-Martin Charcot, and which led him to have the study on hysteria and the unconscious mind. And Freud established his own private practice focusing on treatment of nervous disorders. And he also, like I told you, his study was mostly focused on hysteria. And Joseph Breuer is one person with whom he was closely associated. And they came up with the concept of unconscious mental process. Okay, there are different states of mind like pre-conscious, subconscious, conscious state, and unconscious state. But Freud was mostly drawn towards the unconscious state of mind and its influence on the behavior and personality of individuals. So thus, Freud introduced the term psychoanalysis to describe his therapeutic method. So his thing was to know the different states of mind and develop a therapeutic process for which he came up with the name as psychoanalysis. The next one, sir. And he published landmark book, The Interpretation of Dreams, which explores the significance of dreams, isn't it? Many times what happens is, even in our context also, even in our cultural context also, there are certain beliefs that we have over dreams. Many of us still believe like the dreams that come during the early morning hours might turn true, isn't it? We have different beliefs or different things that is pertain to dreams. Sigmund Freud said, like, most of the things that we dream about would be certain desires or certain childhood experiences or the urges which are not satisfied. So he said, like, the dreams would be having two types, like two types of mostly the latent dream which is not described, for which he has come up with different concepts how the latent dreams could be obscured. Mostly what happens is, when there are any sort of urges you have, they would be manifesting in your dreams. For instance, most of the work of Freud is like it is related to the sexual desires. So any sexual urges or sexual desires that are not met, or that are what to say, if they are not fulfilled, so those manifestations would come into your dreams. For instance, like for example, if there is any sort of anxiety or any sort of, you feel like you would dream of something abase in sense which doesn't have any base. So you feel like you are falling into a fire, you are falling into water, or you are trying to run. So it shows like there is something that is haunting you, and this, when you're having repetitive dreams like this, and in interpretations, it eventually will lead that you are anxious about something. The interpretation of dreams explores the significance of your dreams and their relation to unconscious desires or conflicts. The next slide, sir. So Freud established Psychological Wednesday Society, and later it became Vienna Psychoanalytic Society. We still have International Psychoanalytic Association as well. This platform has brought in all the professionals who are interested in psychoanalysis. You know, like there are a few contemporaries who followed Freud. When we take Carl Jung, we feel he is a follower of Freud's theory, but he was a contemporary. He was equally, he belonged to the same period of Freud. So both of them belong to the same era, and most of the work of Carl Jung's were influenced by Freud's theory. The next slide, sir. And his followers were Alfred Adler, Karen Horney, and his daughter Anna Freud. These were a few people who got influenced with the work of Sigmund Freud. The next slide, sir. So in 1905, Freud introduced the concept of Oedipus complex. So we all know, like, we have 5 different psychosexual stages. The first one would be your oral stage. The second one is your anal stage. The third one would be your phallic, latent, and genital stage, isn't it? During the phallic stage, Freud described like usually boys will have an affinity or philic. Philic means having a love or affinity towards their mother. So Oedipus is one person who killed his father to marry his mother. So this is known as Oedipus complex, and also he described the Electra complex also, wherein girls are more affiliated towards the father. For any girl, the father will be the first hero, and during this stage, they are like having affinity towards their father-mother. In the chat box, someone has described, when I talk about Freud, what comes to your mind? They have written as father-mother issue, if I'm not wrong. But these are different stages, psychosexual stages, and whenever there is any sort of urge that is not fulfilled during these stages, so there will be a fixation that happens into your personality. For instance, during the oral stage, if a person is devoid of that urge, so what happens is there will be a fixation in his personality. For instance, if in oral stage, you all know, usually the baby tries to suck the thumb or takes breastfeeding. Okay, if the mother is not there, if the baby is devoid of breastfeeding, probably some fixation would happen, and later in his personality there would be any fixation that can happen. He may be having the habit of smoking cigarettes, or some sort of with the oral thing. So in 1900, Freud embarked on lectures to United States. That's when he has introduced this psychoanalysis concept to US, and he became he became famous, and he started to gain international recognition. The next slide, sir. 1913 was when Freud published Totem and Taboo, in which he explored the origin of social and cultural phenomenon. So not only how the social and the cultural influences have an impact on your personality would be discovered in Totem and Taboo. The next slide, sir. So in 1920, Freud established like I told you, the IPA to promote the practice and study of psychoanalysis worldwide. Believe me, even now, many of the therapists feel like the therapeutic process of free association works wonders with their clients. There are therapists even now who religiously believe in the concept of psychoanalysis and they follow psychoanalytic way of therapy in their practice. The next slide, sir. So 1923, Freud, he was diagnosed with cancer. There was a small tumor in his jaw and which eventually developed and it really affected his eyeball as well. So he had a lot of health issues and eventually he succumbed to cancer. He requested his friend. He was on morphine. He had unbearable pain and he pleaded like he be given morphine and that's how his death has happened.
Dr. Veena, can you add your experience on cancer research?
Yes, sir. Sir, yes, when we talk about cancer and psychology, when a person is affected with cancer, it's not only that he is physically affected, there are a lot of other domains that are involved. The psychological, social aspects and also the spiritual aspect play an important role in your cancer treatment. And when we talk about psycho-oncology, it doesn't mean like it happens only when the person is infected with cancer. Even before the diagnosis, for the screenings or creating awareness on cancer, the psycho-oncology plays an important role. So we deal with various issues, psychosocial issues, be it body image, be it the psychological issues like anxiety, depression. Anxiety and depression are like comorbids if a person is having cancer. There will be a lot of family issues as well. The issues between caregiver burden is one issue. And when we look at the social aspects, the financial commitments or the relationship, the marital relationship or the family dynamics, everything will be there that has to be addressed. The sexual relationship and regards to the spirituality, because spiritual domain is one thing wherein it helps the patient to have a better quality of life. So I think even sometimes while treating with cancer, there are a lot of techniques that we apply, be it your CBT or be it guided imagery or nowadays mindfulness is there which plays a very helpful. So gratitude and journaling also has positive impact in cancer treatment. Like for them, it will be really helpful for them to have a better quality of psycho-oncology. Yes. So when we come back to Freud's book on civilization, it's Discontents. This is one book I am yet to read because even I am very much inspired by, I really like to read the works of Freud. I have interpretation of dreams. This is one book which I'm really wanting to read. I'm yet to read this book. So it is published examining the inherent conflict between individual desires and societal constraints. It was written in 1930 and we are nearing 2030. Almost 7 years will be in 2030, but still there exist the conflicts. Each individual will have his own struggle with his own desires and the societal norms, isn't it? Even after a century, almost a century, the situation still prevails. The next slide, sir. So in 1938, we all know things happening, and there were people, and I have to say that Sigmund Freud was a Jew. His father was Jew, and there were conflicts between the Nazis and the Jews in those periods. And with the rise of Nazi power, Freud and his family had to flee from Austria, and they settled in London because that was a very sensitive war zone area, and a lot of we need not say it on the public platform here, but still we all know the history. And recent movie Oppenheimer, you must be knowing about what has happened during those times, how the invention of the atom bomb or hydrogen bomb has come, and yeah, it's always better to know about our history. And in 1939, Sigmund Freud passed away on September 23 in London. Like I told you, he was suffering with cancer and he had intolerable pain, and he was on morphine treatment. In those days, the treatment for cancer was very limited, and he urged his friend to give him extra dose of morphine because he had excruciating pain. That's how the era of Freud has come to close. This is about Sigmund Freud, and thank you so much for this opportunity. And when we want to discuss about the works of Freud, I'm sure we will be taking minimum 20 to 30 sessions, because each of his work is so invaluable for us. Like even after so many years, there are staunch followers of psychoanalysis theory, and always people will be carrying a special place for Freud in their hearts. Thank you for this opportunity. If you have any doubts, you can just put it. This is just like a timeline, as we have a timeline in Facebook for ourselves. This is a timeline and a tribute on behalf of Mental Health webinar series for the greatest psychologist, Sigmund Freud.
Thank you, Dr. Veena, for a lovely presentation regarding him, and even not only given the timeline, you given the key components of his timeline also. Thank you so much.
Are unconscious, because many a times we see nonsensical dreams and some things which don't make sense at all, and we don't even think about it, and it just appears, and that's what surprises me.
Yes, like I told you, dream analysis has two parts, okay? The interpretation of your dreams has a latent part and okay. What exactly happens is when you want something in your life, and when you're really thinking about it most of the times, without you knowing, most of the times what happens is most of the dream which you, after waking, which you recollect, no, that part is different, but the part which you are not able to recollect, the dream is like that's the latent dream that usually is related to your unconscious state of mind. So Sigmund Freud is mostly he worked on that to know like why unconscious mind plays an important role in your dreams. Okay, many times it shows it's nonsensical, it doesn't make any sense, but still in those days when the client is allowed to have that free association, asking like, because we all know like in free psychoanalysis is one thing wherein the client is made to relax over a couch and ask whatever comes to his mind. No, in your relaxed state of mind, sometimes you tend to go in, you tend to interpret what happens, you tend to talk of all the things. So psychoanalysis is a talkative therapy. No, you don't like judge and you talk whatever comes. Sometimes you tend to say things which you really don't focus. When you are conscious, you tend to like not give that much of importance to that. But still during the process of psychoanalysis and during free association, you will be able to recollect and you will be able to about these things. So then when you finally do the connections, this would be somewhere, sometimes the projection, no, we talk about the projections. So somewhere what you have been resisting would be manifesting in your dreams. This happens.
Thank you, ma'am. And ma'am, one more question. I don't know whether it is related to this or not, but it is related to dreams only. Like suppose you keep on seeing something in your dream, and after some period of time, it manifests into reality. And whatever you see, it happens in real life. And it may be horrible, it may be very horrible, but it does manifest. So what would you like to say on this?
I mean, can you repeat it again, Jyoti?
Like it may be some experience you have to go through, but before you go through that experience, you see it in your dream that you are going through it. And when you get up and you say, oh, how is this possible? And after some time, it really manifests in your life and you have to go through it. And it is very horrible. But whatever you see, it keeps on happening in your life. So what would you say on this?
See, sometimes there is something known as sense of deja vu, isn't it? Deja vu or something like instincts, no? Instincts. That's what, there will be certain instincts within you. Sometimes people will have look, I mean, whether this is pertain to your dreams or not, certain people have this ability of clairvoyance or insightfulness or instincts, gut instincts, wherein they are a sense of deja vu. We say like some people will feel like something is not good or something what is happening, intuition. So this is not correct. There is a gut feel that says that this is not right, but still you keep on repeatedly getting these things. So maybe when you are more, no, this is what subconsciously or unconsciously something is happening into your mind, and you are trying to put it at some end, not trying to have or venting it out. When certain things are not vented out, you don't have to suppress it. They manifest in your dreams.
Yeah, thank you, sir. Yeah, Rajesh, sir.
Vinny, ma'am, wonderful section. Actually, I got the point. And actually, Suresh, sir, I would like to, express my gratitude this forum.
What? The personality of Freud. Okay, he is one person who was inquisitive about the work. Like I told you, he was working on the hysteria patients and with the neurology, and he was inquisitive to know more about like what are the different types of mindsets and how it has an impact over your personality. So when it comes to his personality, he must be one who is always exploring, trying to explore and come up with new ideas or giving concepts or thinking out of the box. Who would in those days say, because that was a period of where people wouldn't talk about sexual desires or about the libido aspect. No, he talked about the libido and the sexual aspects. No, he would have faced so much of criticism. He would have not. He has faced so much of criticism because in those era, talking about those things wasn't welcoming as well. So. As I don't belong to his era, I don't know what sort of, but definitely he would be belonging to type A personality.
Okay, ma'am. Thank you so much.
So Sigmund Freud, concept, correct, okay.
I think it comes up Sigmund Freud concepts, right? It is the analysis over the Sigmund Freud and further research has been happened out of that. That is what I came to know. I don't know whether I'm wrong, right or wrong. and just I want that nothing between these two concepts.
Because we don't have that much time, I'll tell you, like in TA, we have the ego stages at the parent, child, and adult ego stages. And the script that happens between these three states of ego is different. The nurturing stage, like the nurture parent stage. The conflicts happen between the three stages of the ego. Be it the child, there will be a conflict between the child and the parent stage, or the child and the adult stage, sometimes the adult and parent stage. Okay? This is what happens in your transactional analysis. But what Freud has told is, like if anything happens, things happen if you have any repressed desires or suppressed desires or wishes that are not fulfilled in your childhood. No, the conflicts would arise in your personality. So this is what I can say. Yes, Suresh sir has given. So with
thank
this
you so much.
time,
Thank you so much, Suresh sir. I've been able to. The letters are very small, so I couldn't. Still, I will try to make it understand. Thank you so much for your online explanation.
Yes, we have a limited time. Thank you. Like I told you, Sigmund Freud's work are intensive, and this is the whatever the comparison I could make for TA and Freud's, because TA we have three ego states, and Freud's thing is a little bit different. Yeah. Thank you, Malika. I think Gayatri has asked about the pre-conscious mind. Pre-conscious mind is what is not happening now, we are not aware of now, but that is there. For instance, if I ask you, like, what did you eat for yesterday night or something, what did you wear yesterday, that you can all should say you can recollect it. But if I ask you something very specific, what did you do on 15th August, if you are born like 1980s, what were you doing on 15th August 1990? You'll not be able to recollect it, isn't it? So that would have been pushed in your subconscious or unconscious state of mind. That would be there somewhere. But pre-conscious, that will be there, you will be able to recollect it. No? That's a pre-conscious state of mind. Yes.
Thank you, madam. Thank you.
Yes, ma'am. Kaushalya, ma'am. Kaushalya Karthikeyan.
Yes, I'm sorry to interrupt. Good evening to all of you. I would like to give the difference between Freud's ego and Burns' ego states. Shall I go ahead? Is that fine?
Yes, ma'am, please.
Yeah, so Freud's contribution is about the abstract thoughts, the subconscious, unconscious, and the conscious mind, which we can understand in an abstract level. But Burns' theory is about the ego states, which we can observe behaviorally. The thinking, feeling, and behavior can be observed. So that's the difference between the Freud's and Burns. Yes, thank you.
Thank you, ma'am. Thank you for adding up to what Malika has.
Yeah, thank you.
Thank you. Yeah, I think Vivi raised his hand. Yeah, Vivi.
Yeah, hello, Veena ma'am. Thank you so much for the insightful session. This is Vinod speaking. I wanted to understand in today's world, where can we implement Freud's analysis, his psychoanalytic process, in today's world specifically, where it can be actually implemented?
See, in today's world, many people wanted to be heard. Many a times their voice is being suppressed. No, you allow a person, allow them to vent out their feelings, they feel better. Most of the times, be it in family or be it in organization, most of the people try to suppress their emotions, their thoughts, which would be manifesting in aggressive behaviors. No, this is what. So, you could apply the same catharsis process or venting out feeling. You allow people to talk. You allow them, or you say that you are being hurt. The catharsis will really give them relief. So this is how you can apply Freud's theory to today's present scenario.
Right, ma'am, because a lot of therapeutic techniques are based out of some basis of Freud's analysis is incorporated in today's therapeutic techniques.
Yes, yes. Yeah.
So, and some of them are quite deep in concepts as well. So I was also trying to relate to the counseling techniques and therapeutic techniques. Where can be implemented? Whether it will be in hypnotherapy or whether it will be because at least you do it in dream analysis, right? So that is one thing which I was wanting to understand where you can apply it. But thank you so much, ma'am.
Yes, yes. You can have your hypnosis. Hypnosis is mostly associated with this, like Freud's theory. Hypnosis could be done. Like I told you, it's a talkative therapy.
Right.
So any therapies that's based on this talkative therapy, you can, and mostly like most of the therapies that have evolved, like be it the play therapy, all these things where you are having a free associations. These all could be. They take things. They are built upon the concepts of these free associations.
Thank you so much, ma'am.
Yes, thank you.
Thank you, Vinod.
Yes, thank you, Sonalaji.
Yeah. She is more than friend to me. She only introduced this platform, and from the very